And welcome everyone to the weekly webinar. Some of you were privy to what I hope was at least somewhat interesting conversation. Now you know all my business. And we will shift to the topic of the day. Looks like you're all muted. Thank you. And feel free to use the closed captioning feature as you need to. And the chat, please, if you have questions or comments for our presenter today, I'll watch that as she presents. And I think that is it for now because we were very eager to hear about the guide program, and guide is guiding to an improved dementia experience. And we are very lucky to have Jill Sigliana with us as our presenter today. Jill is the executive director of an organization called Memory Care Home Solutions, which is a nonprofit organization across the way from us in St. Louis. And of course, Jill and her team work to improve quality of life and dignity for folks with dementia and their families. And they do that with evidence based interventions and accessible healthcare solutions. Jill has a lot of experience, including a Master of Science in Occupational Therapy from Washington University, a fellow Alzheimer's Disease Research Center.
Mhm.
And she's authored articles for journals and textbooks and facilitates the dementia community practice for the American Occupational Therapy Association. So Jill is well placed to tell us about Guide today. Jill, welcome. You can share your screen as you want to, and we are very excited. I've known about Guide for I think about a year now or more, and I'm excited to hear more details about what it entails.
Well, I'm thrilled to share more details because I am also very excited about this new benefit that Medicare is trialing and excited to talk about it today. So I'll share a little bit of information about how Guide fits into the work of my organization and then help you learn how you might connect with a guide provider in your area. And we'll have plenty of time for questions. So just jot them down and we'll make sure we have time to talk toward the end. Kelly, can you see my screen okay? Okay.
Yeah,
Okay.
yes.
And you don't see the extra.
Nope. We
Okay.
only see the what we're supposed to see.
Okay. Great. Well, here is a snapshot of the family that prompted the founding of my organization. So, this is the Barron family. 25 years ago, the lady in the middle, Lisa Barron, found her own family going through a caregiving scenario with her mother-in-law Betty, who's the lady in the yellow and white stripes, and they were very surprised by Betty's early onset of Alzheimer's disease. And also, and maybe even more importantly, they were really concerned about the toll it was taking on her husband, Charles. So they, as a family, got together and they're like, what are we going to do? How do we keep dad healthy while he's supporting mom? They both seem to be struggling immensely. And Lisa and the whole Barron family said, if we are struggling to understand how to manage dementia progression at home, there's probably a lot of families out there in our region, in the country, in the world who are having the same struggles. So, based on their family's experience, Lisa Barron started this nonprofit in 2002, and we have been serving our community primarily in the St. Louis region, but throughout the entire state of Missouri and through Southern Illinois with some really great services that help families navigate the progression of dementia at home. And our core service is a dementia navigation program. And this is where, for us, the guide program that I'm going to be describing to you today is fits within our dementia navigation program that we've been delivering for over 20 years. So, in our navigation program, we have a really amazing interdisciplinary team of occupational therapists and social workers, dementia navigators, a pharmacist, and a medical director who all put their heads together and figure out how to support families based on each family's priorities and needs and challenges to stay healthy and happy and safe at home for as long as possible. And the evidence-based model that we use for our dementia navigation program is called the Care Ecosystem, which was developed at the University of California, San Francisco. Um, and I like to pause here just to say why is an evidence-based model important? And I know on this webinar you have spoken before about, for example, the new disease modifying drugs for Alzheimer's disease. So, and before drugs like that ever get into the hands of people who need them, they are studied and tested for many, many years, so that we know that they're effective and safe and that the benefits outweigh the risks. But what most people don't know is that there have been decades worth of research on non-drug dementia practices and treatments. Um, but because there isn't a payment mechanism for them within healthcare, like there is for drugs, these non-drug interventions kind of fizzle out and never really make it into the hands of the people who need them. So that's what we've been doing for 20 years, is taking these awesome care practices and interventions that have been researched not by us at Memory Care Home Solutions, but by researchers at places like Alzheimer's disease research centers, and getting them into the hands of people who need them. So that's kind of the core of what we do. We also have an in-home occupational therapy service that helps families who want to learn hands-on care strategies at home. So maybe a caregiver is struggling with how do we overcome this resistance to bathing and actually accomplish a shower? Well, we can send our OTs out to help the family overcome the challenges with bathing so that the family and the person living with dementia can accomplish that hygiene task together in a way that works for everybody. We also offer individual counseling to support the mental health of family caregivers. So that's kind of one of the reasons why the Barron family were very worried about Charles, is because they saw that his mental health took a real turn for the worse when he was in his caregiving years. And they realized how important it is for family caregivers to have some dedicated support to work on their own coping strategies, their own mental health, um, to prepare them for the long journey of caregiving. And then we at Memory Care Home Solutions do a lot of community and professional education, just like what we're doing here today. And the great news is that we study our outcomes a lot and find that through these programs, family care partners feel better, improve their skills, improve their confidence, and feel less stressed. And also, people living with dementia stay healthier. When we can intervene in ways that keep them safe at home, people living with dementia spend less time in the hospital, and have fewer adverse health events. So that kind of brings us to the guide model. So we were advocates for many, many years, saying, hey, Medicare, let's, you know, we could serve more people, if this was covered in their health insurance benefits. So prior to Guide, for example, my organization as a nonprofit, we fundraise, receive some funding through the state of Missouri, through federal grants, and we do a lot of fundraising events to raise the money to deliver these services, because we know people really need them. And that's great for us as a nonprofit, but that's not how most businesses can operate. They need to get paid for the services that they deliver. So for that reason and many more, we and many other organizations, including the Alzheimer's Association and other advocacy organizations, have really been fighting for a model like this for many years. So we were all very excited in 2023 when Medicare announced it would be testing a model of comprehensive care coordination and management for people living with dementia in the community. And they were going to call it GUIDE. And as Kelly mentioned, GUIDE is an acronym for Guiding and an Improved Dementia Experience. So this slide kind of outlines the purpose of GUIDE. So number one, it provides care coordination from an interdisciplinary team for people living with dementia. And part two is it provides a lot of support and education for informal caregivers. Often those are family members, but sometimes they're friends or neighbors. It's whoever is the person who is involved in the life, informally involved in the life of the person living with dementia. So the family caregivers or the informal caregivers get a lot of support through access to support groups, to individual education and training to help them learn more about what's a normal part of dementia versus what's something we should really be worried about. Like, is this symptom normal? Is there a strategy for this? When do we call the doctor? Um, and I think what a part of Guide that might be most exciting is that this model also provides an annual respite benefit. And that is a value of $2,500 each year that a person stays involved in the Guide model. And this respite benefit can be used for in-home care. So for a paid caregiver to come into the home and relieve the family caregiver for a few hours. It can also be used for adult day services, which is where the person with dementia attends a day program with activities and meals and lots of social time so that the caregiver can have their time and their home and their space to themselves. Or it can be used for a facility-based overnight respite stay. So, for example, if a caregiver has to go out of town for a wedding, because Kelly and I were talking about traveling for weddings before the meeting started, the person with dementia could stay at a facility that provides overnight respite while the family traveled to be part of an event out of town. So, this is all really exciting because and very historic because never so Medicare was in is created, it started in 1965. So in all of that time since 1965, Medicare has never once extended a benefit beyond the beneficiary. So or the patient. So in the case of this model, the patient is the person living with dementia. But this is the first time our federal health insurance program is acknowledging the often invisible workforce, which are family caregivers. So this is a very big deal in Medicare that we're acknowledging and validating the very important contributions of family caregivers by providing a covered benefit that serves both the patient and the family caregiver. So you might be wondering who is eligible to participate in this great new model. And there are some very specific eligibility criteria. So number one, a person has to have a diagnosis of dementia. And it might be, so and if you or your loved one doesn't already have a diagnosis, your guide organization, your guide provider may be able to help you with that, either by assessing you themselves or by getting you referred to a physician or a practice where they can help you with a diagnosis. Number two, the person living with dementia must have Medicare Parts A and B. Um, so this is only for people who are enrolled in the original Medicare. It does not include people who have Medicare Advantage plans. So those Advantage plans are called Medicare Part C plans. And Kelly is our resident Medicare expert, so she can help us understand some of the complexities of that if we have more questions. But for example, in the state where we provide most of our service, the state of Missouri, about half of the people enrolled in Medicare actually have a Medicare Advantage plan. So, and the other half have Medicare Parts A and B. So this is a confusing piece because a lot of times people they think, well, I have a Medicare plan. It's a Medicare Advantage plan. And that is true. But this model, while it's in its test phase, is only available to people with Medicare A and B. The person living with dementia cannot already reside in a long-term nursing home. This is really for people who are at home in the community because we're trying to help prevent or delay the need for a nursing home through this model. But you can live in an assisted living facility. It just can't be a nursing home. And this is also not for people who are already on hospice service, because hospice is a tremendous and wonderful service, and it's the right service when you need it, but it is also very comprehensive in the care that it provides. So you wouldn't need a guide program and a hospice program. And the same thing goes for PACE. And I don't know if you have PACE programs. You do have PACE programs in Kansas. We don't have many in Missouri. We have one, but PACE stands for Program of All-Inclusive Care for the Elderly. Also, it's a wonderful service and program, very comprehensive, so kind of similar to hospice. You're having all of your needs met either through hospice or through PACE, and you wouldn't also need to participate in GUIDE. So these are the eligibility criteria, and if you think you meet these criteria, you get connected with a guide provider, and then they do have by the rules of participation have to do this thing called an alignment check, where they'll do the guide provider will do an assessment with you as the patient and family, and then they'll send the information to Medicare. Medicare will say, yep, check, check, check. We see the right diagnosis. We see that you have Medicare A and B. We're going to give you the stamp of approval. You are officially in a guide program. So that's the voluntary alignment process. And then once you're in the program, you have access to a really wide assortment of services. Those include everything on this screen. You get that comprehensive assessment of what are the needs of the patient and what are the needs of the family caregiver. And there's a home safety visit to say, is the home setting safe? Is there anything we can recommend to prevent wandering or fall risks or make medication management safer? Um, there's also a care plan established. The patients and families have access to a 24/7 line to reach their navigators. They have regular monthly check-ins with their assigned navigator and get a lot of support in terms of referrals to other community resources like support groups or home delivered meals, transportation services. Um, and caregivers also get access to a lot of education. The interdisciplinary team, whether that's the doctor or the pharmacist, review the medications to see, is there anything that on this medication list that could be worsening dementia symptoms? And maybe we could stop or discontinue a few medications because we don't need them anymore. How can we make the medications safer? Um, and then there's also some support around any time that you need to coordinate care between your primary care doctor and maybe your neurologist, or you unfortunately have to have a hospital stay and you need somebody to advocate for your needs as a person living with dementia while you're in the hospital. So that kind of support around care transitions is also a part of the guide model. And I should mention that this is not, this is a Medicare pilot. So, and it's going to be a pilot for 7 more years. So it's a long pilot. And while it's in the pilot stage, Medicare is learning about the benefits of the service. So they're kind of studying, do people stay healthier? Do we keep people out of nursing homes? Are caregivers feeling more equipped and less stressed for the job of caregiving? Um, And if we can say yes to all those things, that, hey, this really does make care better. And by making care better, it probably saves Medicare some money too in the overall cost of care because people are spending less time in nursing homes and hospitals. Then they will make the decision at the end of the pilot phase about whether or not this becomes a real official Medicare benefit. And then if it does, the Medicare Advantage plans will also have to offer it, but we won't know right away if it becomes an official benefit or not. So we're just living through the pilot phase first, but this is a great time to take advantage of the model if there is a provider near you. So I've listed on our slides the website where you can go to check. Right now, there are about 350 organizations across the country who are delivering guide services. I did a quick scan to see who in our area is delivering guide. Unfortunately, Missouri has more to offer than Kansas. I could only find one Kansas-based provider on the Medicare approved list. There could be others, but CareND is on record as being a provider in Kansas. In Missouri, we have more options. But I was telling Kelly before the call started, um, some of these guide participant organizations are telehealth companies. So they really aren't restricted by physical office space. And they could, so some of these, like, for example, in our Missouri providers, Harmonic and Ripple are telehealth companies. So they can very easily expand to other states. Um, and hopefully some of those sorts of providers will also be getting into Kansas over the next 7 years of the pilot phase. And then I also am sharing some information for people who are interested in memory care home solutions and would like to stay in the loop about our guide program or learn more about our services and education. We also have a great YouTube page where we post short videos with dementia care strategies. So check us out there. And that brings us to the end of the overview of guide, but we still have time for questions. So is there anything that I can answer for you all about the guide program?
Wow, thank you, Jill. We'll give folks a bit to think of any questions. I just want to mention that I put a bunch of links in the chat. I put your links, Jill, from your slides, in case people were trying to click. I may or may not have been trying to click the screen and realized I couldn't click your screen. So I copied the links down and they're in the chat. And if anybody wants to have those by email, feel free to send an email to me and I'll be happy to get those. Jill, would you be willing to share your
Oh,
presentation?
absolutely. Yes.
So you can send an email to myalliance@kumc.edu if you'd like to have that.
And
Um,
really, most of these slides I didn't create. They're fresh from the Medicare website. So you can also
oh,
Google
perfect.
CMS, that's the Centers for Medicare and Medicaid Services, CMS guide model, and you will find all of the information you ever wanted to know and more about the guide model.
Excellent. Thank you. So I do want to go to our question about TRICARE for Life, which every time I even say the word TRICARE, I think that's such great coverage. But
Yes,
TRICARE for
yes.
Life, that has an ECHO program that provides respite care, and it is a secondary provider to Medicare. Would the
Hmm.
pilot status of Guide affect the TRICARE coverage? So I think what our questioner is asking is, can you have TRICARE for Life and participate in Guide?
If Medicare is your primary insurance and TRICARE is your secondary, then yes. As long as Medicare is your primary insurance, you would be eligible for Guide. And Guide would work on top of any other benefits that you might have access to through VA
Mhm.
benefits.
I agree. Thank you for starting the answer, Jill. But yes, I think that's correct. It's all part of a fancy program that Medicare calls coordination of benefits.
Yep.
And you can get like a doctoral degree in understanding coordination of benefits.
Yes.
But basically, what it means is that Medicare pays first, somebody else pays second, and eventually, hopefully, in an ideal world, everything gets covered. So, good question. And yes, Mr. Holtis has a question.
Yeah, Jill, this is very exciting because that I'm involved right now. Uh, of course, I'm I'm Mike's dad, and his mother, my wife, passed away, and with the dementia, Lewy body. But we're working with support groups, and right now we kind of fly blind with that. We share what each one of us might have experienced, but
Yep.
each one of these are unique. Every dementia patient is different, and so
Yes.
I think what I posted on my comment was it's very exciting because I believe that because our extended families are away, it might be a way that we could involve extended families in the
Yes.
care and help everybody. Right now, it's usually almost only the spouse that's doing it,
Right.
or a child, and the rest of the family they come and visit and then they go away, but they
Hmm.
don't see it every day. And I think this would really help a total understanding, and it might even be a comfort for the patient to see different family members. It might, in situations, create something. So it's a very exciting program to me. Of course, I'm 92, so I don't even buy green bananas anymore. But it's one of those things that I tell people that I have dreams for things I may never see. But
Yes.
this is one of the best I have heard for caregivers.
I couldn't agree more. And that's something, if your navigator does not offer to engage the extended family, you should ask, because that's so important. Families are never on the same page.
Mhm.
So we routinely in our monthly navigation sessions we have kids zooming in from dorm rooms who might be away at college. We have the out of town siblings. We have, the nice thing is, if when you meet over telehealth, over Zoom, you can invite anyone, and then it does bring a more full understanding of the person living with dementia and the strains on the family caregiver and the needs of the entire family, to many more people. And so you should what we tell families is invite anyone you would like to invite to these meetings, because it only helps to get people on the same page.
Right. Jill, we have a question about whether you can work with any respite company, or are there specific companies in Missouri that will provide the respite care for this program?
So that is a very tricky part of this program. Okay, so and I was going to try to get to this in my slides, but I didn't. I said there's 351 guide providers in the country.
Mhm.
Every guide provider will be doing things a little bit differently.
Mhm.
And I would say they kind of fall into the bucket of health systems.
Mhm.
Some are private practices, like neurology practices, where they're already taking care of a lot of patients who are living with dementia. Um, some are telehealth companies, like the couple we mentioned, local to Missouri. Um, and then some, and very rarely, are they community-based nonprofits like Memory Care Home Solutions. But everybody will deliver their guide program a little bit differently. But Medicare has set a rule that we have to have these very strict contracts in place with the people who will provide respite. And that is for me, I'm a part of, a small nonprofit. It has been a real challenge. So you can't use whoever you want. Unfortunately, you have to use a respite provider who has a contract established with your guide provider. And I'm hoping that as this model gets tested for another 7 years, that will loosen up a little bit, because
Mhm.
I love for people to be able to choose whoever they want to choose, for their respite needs. But right now, there are some restrictions around that, and it has to be whoever is contracted with that guide provider.
Thanks, Jill. That just confirms something that I say a lot about Medicare, and that is, if you ask a question about Medicare, the answer is invariably it depends. Um, so I'm glad Medicare is consistent that way. Um,
Very.
Something I think that's hopeful about that is that I've been doing Medicare education since 2011, so gosh, 14 years. And Medicare has evolved over the years.
Mhm.
I mean, I remember a time when Medicare didn't cover Alzheimer's medication,
Yeah.
and it does now. So I think we can be hopeful over 7 years about Medicare adapting to what people actually need. How about that? We've got Mike has got a hand raised, so Mike, go ahead and ask your question.
Yeah, I just looked at the XLS file that talks about the number of positions. There are a few in Charlottesville, mostly in the larger, or in Virginia, mostly in the larger cities. But it looks like there's a huge expansion on 1 July 25. It looks like a whole bunch of providers are coming on 1 July 25. Is that correct?
That's correct. So there were two tracks when Medicare rolled this program out. There was an established track and a new track. So the established folks started last July, and the new track people are starting this July.
Okay.
So there are brand new programs getting ready to launch next month.
Good. So hang in there is what Jill is telling us, right?
Yep, and check
Um,
back to the map and the spreadsheet on the Medicare website.
Good. Now I just had a thought and it ran away. Oh, I know, it's back. I wanted to point out what you said, Jill, about the telehealth possibilities. So I think that's very encouraging, especially to many of you who are watching now or might watch later, who might live somewhere in Kansas where Guide is not reaching yet. And perhaps a lot of us in Kansas are used to that because of the way the state is structured. But one really great thing about Medicare is that Medicare is Medicare is Medicare in all 50 states. So you can likely, I'm crossing my fingers as I say this in case it's not true, but likely you could access some of these providers if you can get on something like a Zoom meeting, right? You're here on Zoom today, so you can get on Zoom. And if you can get on Zoom, you can probably access some of these providers that provide telehealth services. Maybe that's not as comprehensive as you might want, but it is something. And I'll be eager to see how the respite care piece of that and the financial support shakes out, Jill. I think that's going to be, as I mentioned in the chat, I think that's going to be a game changer. That's going to be so helpful for so many people. So don't count yourself out, even if you don't have a star on the map where you live. I think this probably will develop into being reachable for a lot of people. We are 2 minutes past time, which is a shame because I think we could talk about this for a while. Any other questions real quick? Feel free to ask. Jill, anything else we should know?
No, and I think I left my contact information here. People are welcome to email or reach out to our organization also. And and it's worth asking the providers you're already working with if they know of a guide organization in your area.
Good. So wonderful. Yeah, Jill, if you'll share slides, I will be happy to facilitate getting them to people. They have all those great details, and Jill will just have to have you back.
I'd love to come back, Kelly.
Good.
I'll hang out with you
well.
anytime.
Oh, same. Okay, everyone. Thanks for joining. Next week we will have Dr.
Kelly.
Oh, yes.
I tuned in late. I'm just wondering where you are. That background is, or is it virtual?
It's virtual. I found this on Facebook, the source of so many wonderful and terrible things.
I love it.
Isn't it fun, right? Doesn't it look like I should live here?
Yes, it does.
But yes, alas, it is just a virtual background. I'm at the office on Shawnee Mission Parkway in Fairway. But I just thought this would be fun for today.
Yeah, keep putting those backgrounds up. It helps to vicariously give us a little vacation in this time.
That's right. Okay, so next week we will have Dr. Abdul Rahman Mohammed, who is a cardiologist here at KU Medical Center, and he's going to talk with us about heart health and brain health. We have long known that what's good for the heart is good for the head. And so Dr. Murad is going to share his expertise on cardiology, and we'll get him to divulge some secrets. I think maybe they're not secrets, but some information about how to keep our hearts healthy and our brains healthy. So that's next Thursday, May 29th. Everybody have a great week. Happy Memorial. Well, I don't know if it's happy Memorial Day, but have a nice Memorial Day. You will get a My Alliance email on Monday, but we are closed on Monday. And we'll be back at it Tuesday. And we'll see you Thursday. Okay?
Thank you. Thank you, Kelly and Jill. This is another great one. Thank you.
Thanks for having me.
Good. All right, everyone. Bye-bye.
Bye-bye.